One of the things that we talk about a lot is sometimes it gets very frustrating when people are not doing very well, that they get a lot of evaluation and then come along and we have to repeat it all, and it can be very difficult then because their endoscopy didn't have enough biopsy and they didn't do all these special tests. So people who are not doing very well that are going to come to the centre, we'd like to see them before rather than after they have a lot of evaluation, because sometimes it's then difficult to get the insurance companies to pay for repeat testing. And it gets very frustrating both from our point of view and the patient's point of view. But they don't know, the patients don't know. And like a GI doc will often say, well look, we'll do another colonoscopy and endoscopy, and they come back as negative. And like the other thing that I always say, if the doctors are going to suggest they have a biopsy, the patient should ask, like, who's going to look at the biopsy? Because just the quality of reporting of pathology of these biopsies is not great. Even within this institution, we often look and see who reported it out and have to go and look at the slides ourselves. So it gets a bit frustrating for everyone.
It is frustrating. Just to add to that, we'll often have a patient who says, well, I'll go have my colonoscopy elsewhere and then come back to you, and they do that, and you see that they had a colonoscopy and no biopsies were taken. So we're looking for things like microscopic colitis. You can't diagnose that without biopsies. So the communication isn't there, and it does lead to retesting and more expense and more frustration on everyone's part. So it would be easier, and we'd like to get patients sort of earlier in that course of evaluation.
Yeah, everyone's very busy. I saw a patient the other day, and she said it's not clear whether I got celiac disease, and I said why, and she'd had blood tests done, and then the doctor did an endoscopy, and then afterwards said, oh, the result's not clear, I want you to do the blood tests again. And the blood tests were positive again, and she came in and I looked at the report, and she didn't even have duodenal biopsy. She had an endoscopy with biopsies of the stomach. So I'm sure it was just that the doctor was kind of busy and forgot that the patient was there because of a question of celiac disease, and then you have a bit of difficulty explaining that to the patient. So it's kind of sad when that happens.